So tell me more, Tamie, about your experience and maybe things that are hard to talk about with other people. You can share what you want to share.
It was hard. It was really hard to first go to work. We felt we were working short-staffed. We weren't able to get our work done in a timely manner. They took away part of our department, so we didn't have the room space that we needed to take care of the patients, but they didn't decrease the number of patients we were seeing. They just took the rooms away that we would see them in. Mm-hmm. And we'd ask the hospital for help. Can you give us someone, anyone? And it was like, no, we have no one. We can float over to your department. Mm-hmm. They were short-staffed throughout the hospital. Mm-hmm. So the intensity increased. I know nurses that were going 2 weeks, and in the 2 weeks, they would maybe get 2 or 3 breaks and kept going.
Wow.
And so hospitals were just throwing money at us. Here, we need you, we need you, we need you. But that wasn't fixing the problem, because we were working extremely long hours and picking up these shifts that normally would not be ours to pick up. And there were days that I was taking care of 12 patients in a day.
12 patients?
Yeah, and it was like, it's like a revolving door. It's one after another after another. There were days that I did that with no breaks and no lunches, because the patients needed to be seen. Mm-hmm. There were days that I would say, we can't take any more patients in our department. And then we get a phone call saying, you have a patient you need to take care of. Mm-hmm. There were days that I you'd have to wait to go to the bathroom. And then it was like, you waited so long that you were running to the bathroom. And then if someone was using the bathroom, you had to go to another bathroom. It just kept building and building and building. With what seemed to be no end. I started asking, I said, we need our breaks. I started advocating for breaks. A 15-minute break here, 30 minutes for lunch, a 15-minute break in the afternoon. That's all we're asking. And I kept asking that. So I go to work on Sunday, and it was horrendous. We would ask each other and tell each other, I need to go to the restroom, grab our food out of the little tiny kitchen area that they had. Protein drinks became my best friend. And so we get all done, and that was Sunday, and I come to work Monday morning, and the ward clerk would write this overview about what happened during the week, if we had any orders we needed to check on, what was going on. And at the top of the page in bold letters was, I know Tamie wants her breaks, but patient care comes first.
What?
And
wow.
It was so demoralizing. Wow. To be told that I know I want breaks, but patient care comes first. They did a new break system where they wrote down this piece of paper and you had to sign it and fill it out when you got your breaks. And I was team lead, so I had to go around and tell everyone, did you get your break? You got to go on your break, go on your break. So I was constantly doing that. But internally, I was constantly saying, you're an adult. That's called adulting. Take your break if you need a break. Not even thinking I was one of those ones
that wasn't taking
a break. After that, it's like, oh, you got to get your breaks. And then we would, why didn't you get a break? Why didn't you take a break? It looks here on paper like you should have been able to take a break. But you can't tell from when a patient comes in and goes out in the chart if that nurse has time to take a break, if that nurse has time to catch up on their charting. Then we were told, chart in the rooms while you're doing the care.
Spend more time in the patient's room that has COVID.
Spend more time in the patient's room that has COVID, that has an open wound.
Yeah.
Or that you're given an IV to. Yeah. You hang an IV and then they're expecting you to go take care of another patient right away, because you don't have to be in that room with that IV while it's running. You can take care of those 2 other patients while that patient's getting that infusion. It was traumatizing not being able to do my work and be around my colleagues and take care of these patients that were depending on me. I felt like I was giving subpar care. And then I got to feeling like there was something really wrong with me. What is wrong with me? Everyone else is I had this happy, lucky, I'm a good person and there's nothing wrong. And all these nurses were acting like that around me. So what was wrong with me?
You felt like your experience was different, unique.
I felt like an imposter. I felt totally like I was an imposter. Internally, I was just falling apart. But externally, I was this person that everyone looked up to and everyone came to for their questions, and always the happy one and making people happy.
So if you could take off that external armor and just tell me what was going on inside of you.
I was angry. I was so angry, so upset. You know, there were days at work that I would go into the bathroom and I'd cry, and then I'd come back out. I was feeling like impending doom, like there was something wrong with me. I was feeling inadequate. I felt like, why can't I be like everyone else? Why am I experiencing this? And then I would denial, extreme denial all the time. You're okay. Mentally telling yourself and talking to myself, stop this, you're okay. And my heart would race, and like I said, I would skip beats at work. I would get fluttering, extreme headaches. I worked with a headache for so many months that just would not go away. And upset stomach, you know, and I was a mess. I was just totally a mess, but I was so afraid of showing people that, because nurses don't do that. That's my theory. Nurses aren't allowed to be weak. We have to be the strong ones.
During the initial time of the pandemic, did you feel supported?
I think our administrators are getting it wrong. It was like they were trying, but they weren't really thinking about what they were doing. It was like they didn't care.
They just kept piling it on.
They just piled it on, and it didn't matter if we said we can't do this anymore. It didn't matter if we said I can't take another patient. We were belittled and we were bullied, and they thought that that was okay.
Did you ever feel unsafe?
I did feel unsafe. I felt my patients were unsafe. And we asked for the tracing, contact tracing, and we were told that it was a HIPAA violation and they would not do that. So if we were exposed to a COVID patient in the hospital, we weren't told. We were told that our county health department would get a hold of us and let us know. And I don't know one nurse that was ever contacted. We asked that we would be put up in a hotel room while we were working these shifts, so we didn't have to go home, because we didn't know what COVID was.
Right, or to go home and expose your family.
Yeah, we didn't know. I mean, it was scary.
Did they put you up in hotels?
No, we were told that we were trying to manipulate the system because of COVID and make more money, and that we were using it. They put a tent up and they were remodeling the cafeteria, and we were told that it was $100,000 for this tent. At the end of April, they told us that they were going to do layoffs, and they laid off 20 plus nurses.
Wow.
They continued to remodel the cafeteria while 20 nurses sat at home. So we felt a little slighted there, especially with administration telling us that we were using the pandemic to do nothing but get money from them, and that we were exploiting the pandemic. They gave us cookies. You know, nurses are great. They hung posters in the parking lot that had pictures of nurses on them.
Like the heroes.
Yeah, heroes. We were all heroes and needed to be supported. And they would throw things like pizza parties, and that was all good and well, but when you're not getting a break, it's a little hard to go eat warm pizza. And they'd give us rolls of Lifesavers because you're a lifesaver.
Rolls of
Lifesaver candies.
Wow. How did that feel?
Truthfully, we took it and we smiled, but it was a little demoralizing. They weren't doing anything to help alleviate the stress of the job. They weren't doing anything to get us. I mean, when you are drowning and you need help and you're told there's nobody to help you, Giving me pizza to eat, that's not telling me what my worth is. That's not showing me that I'm there to support you. Giving me someone to help me turn a patient in the bed, or to take a patient load, one patient off of my load so that I have a chance to go to the bathroom and have something to eat. That's telling me that I am supporting. We don't need pizza parties. We need help. There were things that were pretty atrocious. In one hospital in Central Oregon, they created what was called a Weeding Wednesday. So they invited the nurses to come in and spend 2 hours on Wednesday weeding the flower beds.
On their day off.
On their day off. But it builds endorphins and it makes them feel better and it helps to release pressures. And then the nurses found out shortly afterwards that they had laid off all of the groundskeepers for the hospital and that they were asking the nurses to volunteer 2 hours to work. Weeding where they had laid off staff because they said they didn't have the money to support them. They sent out a broad email to all the nurses, and it was a COVID bonus. And when they opened up the email, it was a catfishing scheme to see, they wanted to see who would open the email.
Oh, wow.
So here nurses are fighting for patients' lives. And we have hospital organizations that are basically teasing them and setting them up for failure. We had nurses committing suicide at this time. And administration in some of these hospitals has been very cold to the nurses, I feel. Not even acknowledging the suicide, but asking who was going to cover their shift. So I think they got it wrong.
Wow. Tamie, you're a nurse advocate.
I am.
You're the president of the ONA.
I am the president of the Oregon Nurses Association.
And how is that for you to be treated like that?
It was a wake-up call. It was a total wake-up call that we are being treated no better than just a mechanical instrument to do a job. We have no rights. We have no feelings. How dehumanizing, how devastating that was to me. It changed my value of nursing. It changed how I did my nursing.